On the internet, acne advice can sometimes seem overwhelming. Somebody suggests a 10-step skincare routine, miracle hacks, which often don't deliver. Hi, I'm Dr. Divya Datta, and today I'll be sharing a science-based skincare routine you can follow every day. From general tips to your morning, night, and shower routines. Plus extra hacks you must have not heard before. So this is your go-to guide for acne care. Before we dive into the skincare routines, have you checked out part 1 of my skincare series? If not, you're missing out on the foundation. In that video, I cover the most effective ways to manage acne, including lifestyle changes, medications, and supportive treatments that actually work. So if you haven't watched it yet, pause this video and check part 1 first. It will make everything in this routine make so much more sense. Here's a quick disclaimer. This video is for educational purposes only. I am not a board-certified dermatologist, and this should not replace medical advice from a qualified healthcare professional. Please consult your doctor or dermatologist for diagnosis and treatment tailored to you. Any products mentioned in this video are not sponsored or advertisements. They are shared for general informational purposes only, and I am not financially affiliated with them. Before we begin, here are a few golden rules for acne-prone and sensitive skin. Don't pick or pop your pimples. This will only worsen scars and inflammation. While buying skincare products, make sure they are non-comedogenic, fragrance-free, and pH balanced. Do not overwash your skin. Wash it once or twice a day. Avoid extremes of water. It should not be too hot or too cold. Change your towels and pillowcases regularly. Always cleanse after workouts or after you sweat a lot. And remember, be gentle with your skin. When you wash your face, imagine that you are washing an inflated balloon. Start your morning routine with a gentle cleanser. It should be pH balanced, non-comedogenic, and fragrance-free. If you have sensitive or acne-prone skin, choose a foaming or gel cleanser, and a cleanser which contains the ingredient benzoyl peroxide or salicylic acid is a great option. Now, how do you apply a gel cleanser? Before applying a cleanser, make sure you wash your hands. After washing your hands, wet your face with lukewarm water. Then apply a gentle cleanser. Now, the amount of gentle cleanser you should be applying on your face and neck should be the size of a coin. When you're applying the gentle cleanser on your face, make small, circular motions with your fingers, but do not apply too much pressure on your face. It should feel like you're cleaning an inflated balloon. And if you feel like you're applying too much pressure, use 2 fingers to cleanse your face. Now that I've talked about cleansers, the next step to your morning skincare routine is a niacinamide face serum. Follow the instructions given in your product. Niacinamide is useful for reducing inflammation in the skin, and it also repairs the skin barrier. Now, the third step to your morning skincare routine is using a moisturizer. A moisturizer should be non-comedogenic, pH balanced, and fragrance-free. I personally feel that a moisturizer is the most important step of your morning skincare routine. And if it contains ceramides, hyaluronic acid, or niacinamide, it's a bonus. Now, the last step to your morning skincare routine is choosing the right sunscreen. Make sure it is broad spectrum. That means it should protect you from both UVA and UVB radiations of the sun. It should have an SPF greater than 30. It should be non-comedogenic, fragrance-free, and pH balanced. If you have sensitive skin, choose a mineral sunscreen. Make sure your sunscreen is hypoallergenic. It should not irritate your eyes. Now at night, there are 3 main steps for your skincare routine. First is by using a gentle cleanser. The second step is by using a topical treatment such as retinoids like adapalene. And the third step is using a moisturizer. Now when you start using adapalene gel, it may come off really strong. So basically what you have to do is apply this gel only in problem areas present on your face. And apply this gel only 2 times or 3 times per week. When your skin better tolerates this drug, you can start applying this gel every day. If this drug is not tolerable, you can switch to an alternative, which is known as azelaic acid. Now I'll be sharing a shower routine for your skin. The first step is by using a gentle cleanser. If you are using a cleanser with medications such as benzyl peroxide or salicylic acid, let it sit on your body for 2 to 3 minutes before washing it off. The second step is using a moisturizer. Make sure it is non-comedogenic, fragrance-free, and the third step is spot treatment. If you are using a retinoid like adapalene, apply this gel in the problematic areas of your skin. Now my dermatologist had personally recommended this body spray for my chest and back acne. This Sebidol spray contains salicylic acid, retinol, and tea tree oil. After taking a bath and moisturizing my body, I would spray this over the problematic areas in my chest and back. Now here are a few extra tips if you have acne-prone or sensitive skin. You can exfoliate your body once a week using chemical exfoliants like salicylic acid, glycolic acid, or lactic acid. Do not use physical scrubs. The second tip is to wear loose, breathable fabrics. When you are shopping for clothes, make sure the fabric is either cotton, linen, bamboo fabric, or silk. These cloths help your skin breathe, reduce friction, and cause less irritation to the skin. Do not use clothes like nylon, spandex, or polyesters. Wool can also trap heat and cause friction on your skin. Now let's talk about shaving and acne. A commonly asked question is, does shaving help in acne? And the answer is controversial because shaving is not used in the treatment or prevention of acne. However, if done correctly, shaving can remove hair cells, dead cells, oil. This can help the skin absorb topical treatments like retinoids and benzyl peroxide better. Now here are a few tips on how you can shave safely. Keep at least a 2-day gap between shaving sessions. Never shave over active pimples. Regularly replace the blades of your razors. When you are shaving, the razor should glide over the skin, not dig into the skin. And when you are shaving areas such as the jaw and neck, it should feel like a feather is gliding across your skin. Always shave in the direction of hair growth to prevent razor bumps. And before shaving, you can use skin prep such as applying lukewarm water to your face before shaving or using a shaving cream or gel. And that's a complete skincare framework to help you manage your acne effectively and safely. Remember, consistency is important and it takes time to see the results. But don't forget to like, share, and subscribe to my channel. And in the description, I have given a brief summary about all the skincare routines I have mentioned in this video. Stay tuned for the next video where I'll be answering frequently asked questions related to acne and skincare, so you know what's a fact and what's a myth. Thanks for watching. Take care.